So we have the great fortune today to have Robert here with us. Robert Holt, we met back in 2007, and Robert started, well, why don't you tell us a little bit about your story and about how we first met and where you came from and where you are today.
I started in 2007 at 310 pounds, and I wanted to basically change my life. I was tired of being obese. I knew the road that I was going down was not a healthy road to be on.
And how old were you in 2007? So we go back 8 years.
Yeah. I don't know. 35.
35.
Yes, we'll be 35 years old.
Okay, so you're 35, you find yourself 310 pounds.
Yes, and I've got 4 kids at that time.
Right.
And I make a judgment call that I want to be there for my kids because I know the lifestyle that I'm going with obesity was going to shorten my life. With diabetes, with obesity, with overweightness, with everything, it was not going to be conducive to prolong my life with my children. And I made that decision to do what I did for them so that I would be there for them as they grow up.
Perfect. It totally makes sense. You're 35, 310 pounds, health starting to quake a little bit.
Yes,
Yeah.
just the normal everyday procedures of tying your shoes is exhausting. Going upstairs, just not wanting to do normal activities was a job and a half.
And so when you first made the decision to come, we met each other in Cancun in 2007.
Yes.
And you did, what procedure did you have done?
I had the
Lap band.
lap band.
The gastric lap band. And when you went home with the lap band, it was an easy procedure, an easy recovery for you?
Yes, we was back home in, I want to say 3 to 4 days
Right.
after recovery and back to relearning how to eat and losing weight.
And it was, I remember we picked you up at the airport, we checked in at the hospital, we did your pre-ops, you had your surgery, you're up and walking a few hours later.
Yes.
And the next day, back to the hotel, and the day after that, back home again.
Right.
Okay, so when you got back with your lap band, you started losing weight,
Yes.
right? Okay.
Yes, the lap band worked very well for me for the next
Really
5
well.
years.
Yeah, you had lap band for 5 years.
Yes, and then it became time to change.
Yeah.
I put on probably 30 to 40 pounds.
So what did you lose originally with the lap band?
I got down to 200 and 205 pounds.
Okay, 205
So I lost
pounds.
about 100 pounds, 105 pounds.
Okay, oh, that's fantastic. 100, and then you stabilized, and then you started gaining a little bit.
Yes, I gained up to about 225 pounds whenever I came back this last time for the mini bypass.
Okay, Robert, so you're sitting in Oklahoma, and you have your lap band, and it's working, but not working so well. So what's the decision? How did you make the decision to say, now I want to do something more permanent?
After talking to Dr. Verboonen, after 5 to 6 years with a lap band, it's time to basically upgrade. There's a time limit on the lap band. Things,
For you, it stopped working.
Yeah.
Yeah, it was time
And
to
it
do
was
something.
time to do something different. I liked the skinny me. I didn't like going
Yeah.
back to
Right.
the overweight me. And and I did the lap band knowing that it was fully reversible because I wasn't for sure how everything was going to work. Well, I turned out that I liked being skinny.
Right.
So I wanted to do something more evasive and more permanent and with less
complications, or more like food getting stuck and
less problems, less maintenance. I didn't want to have to do in there as much maintenance with the fills and everything that we was having to do with that. The mini bypass was by far easier to maintain and to work with than the lap band.
So when we went to Oklahoma to do the seminar a year ago in 2014, you asked Dr. Verboonen, what should I do now? And Dr. Verboonen said, it's time to do a mini gastric bypass.
Right.
And that was in June. And then when did you come to Tijuana?
In February.
February 2015.
Yeah.
You decide to do a mini gastric bypass.
Yeah.
Okay. And how was your recovery with that procedure compared to
Oh,
your lap band?
it was awesome.
Good.
I mean, it was the next day we was up walking around, went to the motel checking things out and up walking down the street and going shopping
And that day, what was your weight?
it was 211 pounds,
And today, what's your weight?
170.
170.
Yeah.
And so how quickly did you lose that weight?
That's been 5 weeks ago.
Oh, that's fantastic. So we're talking a very short few months.
Yes.
Okay. So, Robert, is there anything that you'd like to talk about as far as today, your quality of life, the way you eat, and what is your everyday, what kind of patient who has a mini gastric bypass expect to feel as they move forward in life now? What's changed?
Everything. This is a new lease on life. I mean, before you are just so draggy with the weight and you're just so lethargic, you don't want to do anything. And as that weight starts coming off, the energy level just goes through the roof and you want to go outside, you want to go play with the kids, you want to do things because you have all this energy that you didn't have before because of the weight. And it's literally a new lease on life. And anybody that has thought about it, they need to really look at doing it because it is awesome.
And today you can eat anything that you want?
With the lap band, I was restricted with certain foods, breads, pizza. They would swell and have problems. With the mini bypass, there's no restriction. I can eat pretty much anything I want, just in smaller quantities.
Can you drink?
Yes.
Perfect.
Yes.
I'm really, really lucky and happy and blessed that you've joined us here and that you're able to discuss and give us the opportunity to ask questions. There's a lot of people really interested in this procedure, and I think the best way is to listen to people like Robert talk about his testimony and his experience.
Yes, and I'm really happy to know how your life is changing and how you feel now. Thank you for sharing your experience, your testimony with us.
Thanks a lot, Robert.
Thank you.
Thank you.